Hey everyone, and welcome back to the Poultry Doc Podcast. I'm Dr. Blaine Mozeshek, your host and board-certified poultry veterinarian. On this week's episode, we're taking you inside our first live Facebook AMA, where I answered questions straight from backyard chicken keepers just like you. Let's dive in. Okay, well, we've got a live event going, and so we'll go ahead and dive into some of the questions that were submitted earlier. From Colin, we'll start with the hardest first. What's the quickest and easiest, painless way to euthanize a chicken that's a pet? So this is a difficult one, very difficult, obviously, and it comes not easily, but it's one of the things as a veterinarian that we have is enabled to relieve suffering, right? And so while I see many things posted, very traumatic injuries sometimes, and people tend to celebrate when those birds are able to make it through this, just terrible injury. It's kind of upsetting because those animals are in a significant amount of pain, and we don't really have good ways to control pain in birds, at least that are approved, and for the long term. So you have to think, or at least the way I've tried to phrase it, if it was a puppy or a kitten that had that same injury, would we make it go through the same thing, in this case for eggs or whatever it may be? And I know they're pets and we all love them, but it's one of the things, again, that a veterinarian can do is to provide a quick and painless way to prevent suffering, right? So leading into what do we do for euthanasia? Now, from the veterinary standpoint, medically, we can use injectable drugs. Those are controlled substances, and only veterinarians have access to them. Another way that we can do that is with gas. So both like anesthetic gas, which again would be only limited to veterinarians, but there are other ways like CO2 gas, which is an asphyxiation, and that's an approved method. An AVMA, so American Veterinary Medical Association, an approved way to euthanize a chicken. Another way that requires some training, but is probably one that it can be difficult, but once you learn it, it's actually relatively easy, and it's called cervical dislocation. And so you may be aware of, or you may have seen somebody, to break a chicken's neck. Essentially, that's what you're doing, except it's in a controlled way, and it separates the first vertebra from the skull, and immediately renders that bird, one, it's painless, and the bird dies very quickly because you're severing the spinal cord there. So it feels no pain, it happens very quickly, and again, that's an approved way to euthanize a bird. We can cover a video or we'll produce a video, we'll show that in more detail. It's pretty hard to describe, it'll be easier to show. So gas euthanasia will be one, and this is one thing that we will probably offer is a way to a setup that will provide to deliver like CO2 gas into a box and to humanely euthanize your bird. Now remember too, when you do euthanize birds, they will react, right? The nervous system is still active, even though the bird has died. It will respond, and you'll see the bird flapping around. That is normal, and that happens. It's not feeling any pain. It's just part of the nervous system of the bird dying too, because those cells are still alive and active and firing the nerve cells. So that's what we see. Let's see what else. Tamara submitted a question about having a sultan with a turned leg. So there was a video that she posted as well. I was able to see that, and this is a splay leg, is what was shown on the video, and it looked to be bilateral, so both legs were affected. And I don't recall exactly how old it was, but it looked several weeks old. So there's one thing with these, in these breeds of chickens, some are more prone to this than others. And we have to remember that these are very highly selected. And we'll get to another question where this is going to come into play in a second, but really, really selected for physical features, right? Whether that be crested breeds and the Polish or the Silkies and their feathers. And so what happens is when you select animals for specific physical traits, something is usually given up, right? And so in this case, the bones may not grow properly in some of those birds, and that's what this is. It's a genetic malformation. We can try to prevent that or help it with hobbling, and I think that's what she did in the video. But this is a way where in the video you can't see it, but both legs were turned outward. If we create a hobble, basically a brace that would be the width of the leg, or what the width of the legs need to be, so probably 1.5 inches or so in the case of this bird, and tape around those legs and tape them together, we can keep them together and stabilize them as they grow. Because remember, these birds are growing very quickly. So from hatch to about 7 weeks, this bird's going to double in size. So for the most part, and then it depends on breed, but chickens will about double in size in the first week. And so with that doubling of size also comes double the elongation of bones, or the bones are growing twice as much too. So there's a lot of growth that happens in those early days or early stages of development. And so if we can brace those legs, or hobble them in this case, and affect that growth in a positive way, kind of get them going back in terms of overcoming those malformations. That's one thing we can do. So in those cases, it's, again, to kind of go back over, it's early interventions that are going to have the most effect. So, with that bird being 7 or 8 weeks old and already bilaterally splay leg, that's going to be a difficult one to overcome, and will likely always have some sort of deficit in terms of gait. So Wendy has one about treating wry neck, a question about treating wry neck in Silkies. She says the flock is disease negative, no neurologic trauma. They're on 22% protein feed with supplements. I don't know exactly what the supplements are, but Wendy, to your question on wry neck, this is one treating with vitamins is very commonly referred to or used. So wry neck is really a description of a physical abnormality, right? It's not a disease. Torticollis would be the actual real name that's used to describe it. Wry neck is kind of like a common way to say it, and it can be caused by a number of things. Yes, vitamin deficiencies can cause it. And you see me, if you've read our posts or read what I post online, commonly you'll hear me say over and over and over again, birds rarely have vitamin deficiencies, at least as often as many people think. Vitamin deficiencies don't occur like in a vacuum, or not in a vacuum, that's probably not the right way to say it, but they don't occur by themselves. So if you have let's say a true thiamine deficiency, right? So the scenario that would have to happen for a bird to have to be deficient in thiamine, there'd have to be many other things that would be deficient in as well too. Number one, those birds would just look really poor. Their feathering would be poor. They would be depressed. Yes, they may have the neurologic issues that we see, torticollis being one of them, curled toes may be one of them, but there'd be many other things going on. And so, there are many posts online of birds with torticollis that are beautiful. There's nothing wrong with them other than the way the neck is bent, right? So it's either bent forward or bent backward. And yes, we can give vitamins. Many people say that they give vitamins and there's a positive response. But the reality is it's the time that probably helped that bird. Now the vitamins, depending on what they gave, may have helped, but they probably didn't hurt anything. We got to remember too, there are different types of vitamins. There are water soluble and fat soluble vitamins. Water soluble vitamins, the bird's going to pee them out, will do the same thing. Fat soluble vitamins, on the other hand, are not excreted through the urine, and they can build up and they can become toxic too. Selenium is another one that's often mentioned, and the toxic dose of selenium versus what's tolerable by the bird, and any animal really, is very close, right? So there's not a whole lot of room for error there, to the point where selenium inclusion in diets is actually regulated by law. So if you go buy a tube of selenium paste and you're giving that to your bird, keep in mind that there is a toxic level to that particular drug. So to go back to your question, Wendy, you've got Silkies, which these are a crested breed, and it goes back to the genetic selection and things that we've done to get those looks. Part of those crested breeds, one of the issues that they have is what's called a vaulted cranium, right? And so they, just by the formation of their skull, one, it can be very thin at the crest, so sometimes it can even be lacking, so they actually don't have a complete skull at the top, and just very slight pressure in that upper part of the head can cause some of the neurologic signs that we see. So many times what will happen is, as they're growing, those will heal over, but you can have those neurologic deficits, whether it be torticollis or gait issues or bird stumbling, and sometimes they'll grow out of them, other times they will not. And so Yes, you can give vitamins. I don't think that's personally, in my opinion, that's not solving the issue. But just be aware, there's really not a cure for those issues other than time, and hopefully the bird will grow out of it. So TLC to get them through those issues, those neurologic issues that they're having, and keeping them from injuring themselves really too, because that's one of the things that sets that off as well.
A follow-up for that is that why only one chick would get ryeneck and others in the same hatch don't?
Yeah, that's a great follow up there too. So, if it were a true vitamin deficiency, most often we would see it in many birds within the flock, right? When just one bird has it, yes, it's that bird has probably got the malformation, whether it be slight pressure on the brain in a certain area, or potentially, missing or a very thin skull at the top, and maybe it bumped it, right? Because remember, these birds are pecking and they're eating and they're feeding. They can easily bump into things, and just the slightest pressure on the brain can cause some of those nervous deficits that we see.
And is it okay to have laying hens on a 20 to 21% feed all the time? They've read that high protein can hurt their kidneys.
Yeah, so we did a video on this protein inclusion. It was part of a video that we did on feed recently. The actual, the necessary amount of protein for a bird in production is around 16 to 18%. Excess protein, can be poorly digested, right? So as it goes into the GI tract, if it's not digested in the upper GI tract or absorbed there, it will make it to the distal GI tract. We call the ceca, and maybe you've heard of cecal excretions. But when protein or undigested or unabsorbed nutrients make it to the ceca, they can have adverse effects there, because basically we're throwing food at a digestive organ that really takes nearly undigested or undigestible contents and breaks it down even more. So when you give it easily digestible protein, in this case, it can throw off the organisms or the bacteria that are in there, which are many times Clostridia, and Clostridial bacteria can produce toxins. So we have things like necrotic enteritis, maybe something that you've read about. Necrotic enteritis is actually caused by those Clostridial organisms that mainly live in the ceca, having excess protein or excess energy, and they grow at an exponential rate, the bacteria do. And so when they start to increase their populations exponentially, they start producing a toxin. That toxin can cause drastic issues, really severe lesions in the gut, which can cause death too, actually, in some cases. But to go back to your question about layers, 20% is probably not going to affect them that much. Remember, this time of year they're molting, so a little extra protein doesn't hurt to help with feathering issues too. So long-term, 20% protein, probably not an issue.
What about other first aid?
Oh, other first aid kits. So this is one thing the poultry doc is putting together, or that we'll be having on this site. One of the things that I think are very important in there is, or one of the things that you want to have in your kit to take care of is wound care, right? So basic wound care. You'll hear me on many of the videos talk about chlorhexidine. There are other surgical scrubs that you can use to actually clean up a site that have detergents in them. So there's iodine with betadine, for example, that may have a scrub solution that has detergent in it, and so it's sort of soapy, but also has a great antibacterial effect. So betadine scrub is one. Chlorhexidine is another. Those can be with or without detergents. Now, the ones with the detergents, we don't really want to get those in open wounds. The stuff without, like the dilute, just chlorhexidine solution, is a good one that can come in contact more so with open wounds, and those really help to clean those wounds and debride them, and not necessarily sterilize them, but disinfect. And so that's a good one to have. Vet wrap is a very good one to keep on hand. Sterile gauze is another one. Some just tweezers, minor sharp edged scissors is another one, that where you can get in and trim tissues if you have to and get into tight areas. That's a good one to have. I'm thinking like in terms of bumblefoot is one that commonly occurs. So we've got a video where we create like a little boot. So a little slice of a pool noodle is good to have in there, so you can keep a couple of those. And again, we want to pack that with there's some Prid is a draw salve that can be used. So that's something that you want to keep in there. Let's see what else. Tape would be another one. I'm trying to think of some other. I do not recommend to keep antibiotics on hand. I'd rather have those available for treatment when they're needed. One, antibiotics expire. I also don't think that antibiotics should be given willy-nilly. They really need to be used judiciously. That's one thing as a veterinarian. One, we've got to worry about withdrawal times. Those are important because there are residues that are passed into the eggs and into the meat. So each drug that we're going to give should have a withdrawal time. Some of those drugs that are commonly talked about on the forums are illegal, and you may hear me talking about that too. So we really want to stick with drugs that have been approved in the United States. Most importantly, because there's safety and efficacy that goes along with those, and also we really don't know what the bug is, right? So we need to know what it is before we can treat, rather than just throwing an antibiotic at it when it may not work. So that's important. So to that effect, though, it's good to have diagnostic tools on hand, and this is one that we're developing right now. We've got a few tests going out, but it's a way to it's a respiratory diagnostic for Mycoplasma synoviae and Mycoplasma gallisepticum specifically. So it's a PCR test. It's going to be essentially a card and a couple swabs, and you'll take a mouth swab and send that card back in the mail to us. And once we can confirm that, we can again help you out with medications that are needed, or even work with your local veterinarian to get you the right medications that you need. But I'll put together, we'll post a full first aid kit that we'll have online, and probably be selling that at some point. We're looking to poultrydoc.com. We'll kind of roll into full production, so to speak, beginning of the year. So we're excited to bring that to you soon, relatively soon. Sounds like an injury where one bird had a leg injury and was separated from the flock in order to heal, and now we're having reintegration issues, right? Am I summarizing it well? So, you will have pecking order issues, and those birds will have to kind of find their way again, right? So in groups of birds, the pecking order is a real thing. And if that bird comes out of the population for a while, when you remove that bird, those birds kind of reorganized again and went through a similar pecking order recalibration, right? So if she comes back in, they'll do the same thing. If she's weak or sick, in this case with the leg, probably still recovering from the leg, those birds see her as weak, and they may kind of try to force her out or to the side, or again, try to dissociate with her. So one, we can either allow her more time to recover, or keep her separated, probably a combination of those two things, and then slowly reintroduce them. So there's really not an easy answer to that one, or one that's not going to be 100% effective, because it's going to depend on variations from flock to flock, and so it'll just depend on how those treat. If you got a rooster, that's one, you may want to keep that rooster away, or the birds that are being most aggressive, we may separate those most aggressive birds from the others, and so allow her to integrate with that larger population, and then reintroduce the more aggressive birds. So that's one way to try it.
Should you always isolate a hen by themselves, or could you isolate two at a time?
Yeah, it's best. So birds are better, birds of a feather flock together. So birds singularly, that can be stressful. So if we have a hen that has a flock mate that they get along with, keeping two birds together at a minimum is probably the best approach there. So we try not to keep them separated, or at least separated where they're completely separate from the flock. If we need to isolate a bird singularly, it's best to put that bird in a dog kennel, for instance, or a crate carrier, and keep that carrier within the coop so it can still socialize and see its flock mates.
A question about sprouting grains. Hold on, where did it go? Or fermenting the grains to make them more bioavailable.
Yeah, so fermented feed. This is one thing I do not support, because there are many things that can go bad. I feel like this is just clickbait, to be completely honest. Somebody decided, hey, we're going to ferment some feed, and I've got something to talk about, and it's clickbait. So I've seen and read many things about this. First of all, there's no scientific evidence. I've done the work. There's no data to support that fermented feed provides anything more than regular feed. And in actuality, if you want to, people say it provides more energy. That's not true, because when you ferment something, you're losing carbon. So you're fermenting it, you're producing CO2. That CO2 is carbon, that CO2 is energy. So you actually, once you ferment something, it has less energy in it than when you started, right? If we go back to what birds really naturally encounter, they never are eating fermented feed naturally. That just doesn't happen. So we don't want to change things in the diet because we think they're better, right? So people like kimchi, that doesn't necessarily mean birds like kimchi, right? People have been around agriculture for a very long time, thousands of years, and maybe we've adapted to that thing, and we can find ways that we can improve gut health with by supplementing probiotics and bacteria, for example. But there's just really no data to support that in birds. And one of the main reasons I discourage doing this is because if you don't ferment it right, you're actually souring feed, right? So for fermentation to occur, it has to occur without the oxygen present, so in an anaerobic environment. If there's oxygen in there and you're stirring it daily, you're adding air to it. Now you can grow bad bacteria, right? That can cause issues, cause that feed to sour. If it smells bad, it's not going to be good for the feed. And botulism, so Clostridium botulinum is one that can grow. It grows in an anaerobic environment, but if it's there and you're trying to ferment, you can actually have you can produce botulism in your flock. We always hear about the positive things that come, if you're on the forums and you hear people talking positively. I don't think you hear about the negative things that could potentially happen there too. So I discourage fermented feed. Sprouted grains, probably not that big a deal. Yeah, there are those carbohydrates in the grain do change when you sprout them, so that's different than fermenting. So I don't have a problem with sprouted grains. So Angela had submitted a question online or in the comments that her hen was losing weight, right? So I'm not exactly sure how old the hen is, but Angela does biweekly health checks, which I think is great. And I'm not exactly sure what, outside of handling, it sounds like she handles her birds a couple times a week. But one of the very important things you can do to monitor the weight of your flock, and you may have heard us, especially now with the poultry dock flock, is we're taking weights of those birds, right? We're tracking their progress as they grow. You can do the same thing with your older hens as well too. So, you may not need to do it twice a week, but maybe once a month or every couple of weeks. It's very easy to have a scale around the house, and like a postal scale or a kitchen scale that measures in grams. Ideally, not like a bathroom scale like we would have that's in pounds. But to have that scale around and get their weight, just track their weight, like I said, every couple of weeks. Birds' metabolism is very high, and so if they are sick and they go off feed, they start losing weight really quickly. I don't know exactly how much weight Angela's birds have lost, and she's asking why they could be losing the weight. One thing that comes to the top when we're talking about older hens, and again, I don't know how old these birds are, but if they are older, let's say anything over a year, and that bird is healthy and losing weight and eating, neoplasia or cancer is the first thing that comes to mind, and the first thing that's driving that is likely Marek's disease. Now, Marek's can present in many different ways, and honestly, I would say the most common way it presents, most people don't even know it, because Marek's disease, by definition, is an immunosuppressive virus, right? So it suppresses the immune system. Because the Marek's virus itself affects lymphocytes, which are cells of the white blood cells of the immune system. So those are the ones that attack bacteria and attack viruses. And so once the virus infects that cell, it no longer acts like it should, right? It's now a cancer cell, and it's growing without control. So what happens most often is, with that immune system being negatively affected by Marek's, it leaves that bird open or susceptible to secondary infections, other viruses or other bacteria. So, we see those birds get sick and perish, and we think it's from something else, when the main likelihood it could have been Marek's, or it's definitely a rule out. But in Angela's case, with birds losing weight, just like in our human patients, when people have cancer, they often lose weight. The same thing goes with birds as well. So that's one thing I would look for. She mentioned the feed that they were on, which sounds fine. I don't have any problem with the feed that they're on, but parasites are another one that we want to look for. So intestinal parasites, and the burden of intestinal parasites would have to be very high for birds to start losing weight. So I don't think that's at the top of the list, but that's something that you want to consider as well. So unfortunately, there's not really like a great test for Merrick's either. There are tests for Merrick's. However, those tests will always be positive. I know there are a lot of people that say, my flock is Merrick's free and are never vaccinated for Merrick's. We really have to look at Merrick's as being pretty much ubiquitous. It's everywhere. If you go to the feed store and they sell chickens, there's Merrick floating in the air. If you have friends that have chickens and you think yours are separated from theirs and they've had Merrick's, it really is a ubiquitous virus. And so that's actually the one reason why we vaccinate for Merrick's at day of age, is because once those birds are exposed to the wild type virus, they basically, that virus will grow faster and overcome the vaccine. So we need to have the vaccine in first. That's one thing with Merrick's disease.
So Melanie wants to know how they would get a PCR test when they don't have vets that know poultry. The one that you were talking about in the kit?
Well, I would say stay tuned. We'll have that test for sale very shortly. We've got the website is coming along. And
you would hook up with their regular vets, their small animal vets.
Oh, for them to run the tests.
Mm-hmm.
Yeah. So there's very few labs that are actually running these tests. They're trying to think to run a DNA test. In this case, mycoplasma. It's a bacteria that has DNA. That's what we actually look for. Some viruses, for example, are RNA. So depending on what the virus is or what the target is, we may run an RNA or a DNA test. RNA is much more susceptible to degradation, so we have to do things to protect that virus if we want to test for it. DNA is much easier. You can find DNA that are thousands of years old. But to answer your question, it requires specific materials to test, and so there's only a certain number of labs that do it. But if your veterinarian can take a sample swab, in this case we're doing choanal cleft swab. So if you look in a chicken's mouth, it's got a normal cleft palate. That's a normal thing. And we're just going to take a swab of that, rub it on this a special type of paper, and basically you can mail that in. It doesn't require refrigeration, and you can mail it back to a lab that we're contracting with, and they'll run the PCR test. We'll get the results and send those back to you. So we should have that test available for sale within before the end of the year. I'll say it that way. I hate to under-promise and over-deliver is what I want to do. So be on the lookout. Always, and you can send an email too if you got specific questions on specific tests. Feel free to. We're always looking at the comments and we're looking at the posts that are put up there. So if you've got questions about specific tests, love to hear it. Right now we're focused on mycoplasma, but if it's bronchitis or egg drop syndrome, all those tests we can test for those as well too, and we plan to develop those tests.
And the goal would be, if they are positive, that you could partner with their small animal.
Correct. Yeah. So once we confirm mycoplasma in a flock, our goal really is the poultry doc is to provide veterinary telemedicine to everyone. Right. We want to expand access to these backyard flocks, expand veterinary access to backyard flocks. Unfortunately, telemedicine in the veterinary industry is pretty limited to a certain number of states, to a very few number of states. But our goal is to work with local veterinarians, and we will provide them the diagnostics that they need and treatment plans or that your flock may need. And so we could give you a report that you can bring to your veterinarian with everything that we found and a treatment plan, and then work with them so that they can prescribe the necessary drugs to treat your flock. And so if you have those, if you have veterinarians that you work with, drop us an email. You can send an email to info@thepoultrydoc.com. and let us know veterinary contacts that you would like us to work with. We're reaching out and building that veterinary network all the time. So the more people we can add to it, the more clinics we can add to it, the bigger, the more access we can provide and help you out.
And these could be their dog or cat.
Yeah. It doesn't have to be. Actually, probably better that they're not. They can certainly treat chickens, but if they're just dog and cat or small animal veterinarians, large animal vets, doesn't matter. Let us know about them, and we'll reach out and make contact and try to include them in our service.
So how do you correct a foot that's completely backwards on a 4-week-old chicken?
How do we correct a foot on a 4-week-old chicken that is completely backwards? That one, at this age, it's going to be very difficult, outside of a surgical fix. As I mentioned earlier, these birds are growing very quickly, and then by 4 weeks of age, those bones are way more than doubled in size, right? And so those early malformations are just amplified as that bird grows. So unfortunately, it's really going to be supportive care at this point that's going to allow that bird to survive or to do well. I mean, it will always have that deficit. So again, this is one of those where I know these are pets, and we want to do everything we can for them, but we really need to consider long term their quality of life issues, right? And so if that gait is going to be affected, not just gait, but if they're going to, for example, like if it was severe enough where they were just on one leg, that's really not conducive with a healthy long term life, and that's something where we need to consider that, hey, is euthanasia probably a better alternative here than this bird's suffering? So just something to consider. Yeah, so the question was about old feed or potentially moldy feed. Definitely, if there's any suspicion that it's moldy or if it's gotten wet, we want to not use that feed, right? Mycotoxins or fungi can grow in moldy feed, and that fungi can grow toxins or produce toxins. We call them mycotoxins. And there's very specific ones that affect poultry, so they can cause burns in the intestinal tract, or actually sometimes neurologic signs. They can cause kidney issues. There are several different mycotoxins that are formed by molds that are very rough on chickens. So we want to definitely avoid any sort of wet or moldy feed. The other thing too is with old feed, their vitamin E is added to feed as a preservative. It's an antioxidant, and so when feed gets old, fat starts to become rancid. The fat breaks down, right? It happens in our food too. And when that fat becomes rancid or begins to break down from at a molecular level, it gives off free radicals out, and the vitamin E sort of attacks those free radicals and stops it or slows it from happening. So again, what happens is as the fats break down more and more, the vitamin E is consumed, right? So the vitamin E is being used to preserve or stop that fat from breaking down, which means there's less vitamin E in the diet. So that is one way, actually a real way, where birds can become vitamin E deficient, is from feeding old rancid feed. So we want to make sure we've always got good feed. And if you look at your feed ticket, there should be what's the name of the date? There's a date that's typically printed on it, but it's the number date. I'm going blank on what that's actually called. In any case, so your ticket will have your feed label or feed ticket should have the date it was manufactured printed on there. As long as it's within several months, I would say 6 months, it'd be happy. Again, so if it's stored in a really hot environment too, that'll cause fats to break down faster. So just keep that in mind. And rancid feed has a smell to it, right? So if the feed doesn't smell right, it's best to get rid of it and get new feed. Yes. So the question was about adding something to water to prevent mites. There is a new product. You may have heard me write about it in some of the posts. It's called Exult. It's not available yet in backyard chickens. I was actually discussing this morning. So that product should be launched early next year. So thanks to the government shutdown, FDA is not approving things right now. So that's slowing down our approval process and getting that to market. But yeah, we will eventually, early next year, we will have a product that you can give through the water. So we're going to treat the whole flock in this case, because remember, those mites aren't specific to certain birds. And there's no need to handle birds individually anymore. There's also won't be a reason to really treat the premicist, because those mites, in order for them to complete their life cycle, they have to feed on a bird within a known period of time, right? So in some of them it's hours, or sometimes we know they have to eat within a couple days. And so the way this product works is we give it through the water on day 1, and the product stays at a level where it'll kill those mites for about 7 days. And then we give another dose 7 days later, that basically everything dies that's alive in that first week, and then those eggs hatch, the parasite eggs hatch, that they haven't taken a blood meal yet, right? So that second dose now gets those parasites that hatched while before they were killed by the first dose. So really great product coming to market. Again, look for it early next year, and obviously we'll be talking about it as it's released or when it's released. So
can you give your birds liquid acetaminophen?
This is a good one. I actually thought of this earlier and I forgot to say it. In your first aid kit, a good way to manage pain or inflammation in birds or in chickens is aspirin, baby aspirin. So if you do a half a baby aspirin, that's about the right dose for a chicken. So that's a good one. Rather than Tylenol, use aspirin. Appreciate everybody joining. Tell all your friends and support the group, support the page. If you have questions, I try to get to all of them. I know this is growing really, really quickly, and we're bringing others on. So we're bringing other vets on. I'm excited to say as well. Hopefully by next year, the team will be growing. But submit those questions. I try to get to as many as possible, and I'm really excited to continue to support this group. So thanks for everything, and thanks for supporting the page, and we'll see you next time. Thank you.